Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us. Going to have a conversation with Dr. Nick Medendorp this morning, CEO of UV Innovators. He's joining us on the show to talk about NuvaWave. It's the world's first UV handheld that demonstrates killing more than 99.9% of the live COVID virus in just 1 second. Welcome to Health Professional Radio, Dr. Medendorp.
Thank you very much, Neil, for having me.
Talk about your role there briefly as CEO of UV Innovators. What is it that you do?
Yeah, so I've been in light-based technology for the last 25 years, and recognizing, the benefits of not only the different wavelengths of light, how they can stimulate biological responses, but in this case, very specific wavelengths of light are very effective at inactivating and disrupting pathogens such as the SARS-CoV-2 virus. We started UV Innovators with really one thing in mind, which is we need another tool in this fight against these unseen pathogens. The pandemic really highlighted, I think, the general population's awareness that these pathogens are all around us. They're unseen, and in some cases they can be very deadly. Our company was originally focused on reducing hospital-acquired infections. We know that 1 out of every 31 individuals that goes into the hospital unfortunately picks up a pathogen that causes an infection and has a significant impact on the not only the livelihood of staff, but has a significant impact on the overall healthcare costs. So we targeted really the clinicians and asking them, what are the challenges that you have, and how do we help reduce these pathogen-related infections in the hospital? And the clinicians gave us great feedback that the current tools that they have clearly aren't working because we still have infections and we still have this community spread of these pathogens. And so we took a broader look at, what technologies are out there. Ultraviolet disinfection technology has been around for 100 years. And in the hospitals over the last, 10 to 12 years, they've been using these large kind of terminal towers for disinfection at the end of the patient's stay. But there were challenges there, and the clinicians really asked us to help kind of resolve some of those challenges. So that's how UV Innovators was founded.
So what are some of these challenges that you were asked to address?
Well, if you look at today's kind of patient journey, they go into a room and they are there for 2, 3, 4, 5, 6, 7 days, and the ability for the hospitality or the housekeeping teams to be able to come in and kind of regularly clean those rooms, are a challenge. I think this pandemic has really opened up people's eyes to recognize that chemical wipes and sprays really aren't being used correctly, that there's a difference between cleaning and disinfecting. And the disinfection protocols, I'm not sure if you're aware of this, but a lot of those chemical disinfectants, the surface needs to remain wet for 2, 3, 4, up to 10 minutes in order to get, this disinfection reduction of these pathogens, to get a, 3 log or 4 log or 5 log reduction. So 99.9% up to, 5.9% reduction. The surface has to remain wet. And unfortunately, in today's day and age, there's a lot of kind of spray and wipe and away you go. The other challenge is these large UV towers are used at the end of the patient journey. So the patient has already left, and it takes anywhere from 20 minutes to 60 minutes to kind of disinfect the room. They have to move the tower around, and the challenge there is because of shadowing, they're only about 75% effective at actually disinfecting these high touch surfaces. So the clinicians we asked asked us to say, look, if you could create some technology, had the power of that tower, but we want it in the palm of your hand. Is there a way to, throughout the patient journey and other places within, the hospital facility, the nurses station, the break rooms, besides the areas of outbreak, we want to be able to have a new tool in our arsenal against these deadly pathogens.
You say this technology has been around for 100 years. How exactly does this UV technology work to get rid of it, almost 100% of these unseen pathogens, especially in a hospital setting where there's so much activity?
That's been the biggest challenge. That's been the biggest challenge. Mercury vapor lamps, were developed in the early 1900s and have been used for eradication of pathogens. But the challenge is the way the UV light works is it disrupts the DNA of the bacteria. Unfortunately, that also can do that to mammalian cells, certain wavelengths of light, or disrupts the RNA of the virus. And so, being able to use this where people are around, there's been some concern about that. As well as mercury has become, a hazardous substance that needs to be disposed of in a proper way. And so we decided to kind of take the old 100-year-old technology and bring it into this century. And so we have a solid state LED UVC solution. So it doesn't have mercury, so it doesn't have these fragile lamps. It is much more robust and efficient, where we can actually have a battery operated device. So we're not plugging into the wall, so there's no more kind of trip hazards, but you're able to really integrate this into your daily workflow. Because I think that's been the biggest challenge, is when you wait to the end of the patient's journey, you have that spread that can occur as staff and family members and physicians come and go, in and out of those rooms. We all know that these bacteria, they just continue to grow over time. And so if you wait a significant time period, you're going to have a larger, amount of that pathogen that you have to deal with. And so taking our NuvaWave device, and we call it's really a new category. You have these chemical wipes and you have these UV towers that kind of have their place. But when we invented our NuvaWave device, it's really a new category. It's meant to take, UV directly to those high touch surfaces. Mm-hmm. In some cases in the facilities, you have sensitive equipment that you can't really use chemicals on. You have these other areas that are very transient, where you have people coming and going. So you need to be able to disinfect those areas multiple times a day. You can't wait to the end of the night and hope that you get it. You have to, really integrate this into your workflow.
Let's talk a little bit about this NuvaWave device as far as training and maintenance goes, as it relates to staff that are going to be using it. Yeah,
the great part about our NuvaWave device is that the training is very simple. If you can plug in and charge your iPhone, you can use NuvaWave device. We have a very simple battery that is integrated onto a utility belt, and it plugs directly into the NuvaWave device. We just ask that the operator just make sure that they have long sleeves on, and we offer a UVC face shield inside our NuvaWave kit. You want to just make sure that you protect somebody's eyes. I mean, just like if you spray chemicals in somebody's face, if you shine UV light in somebody's face, you could cause an irritation. And so it's very simple and easy to use. Ours is a trigger-operated device. That's really where the instant UV occurs, because we can pull the trigger, instantly start disinfecting the surface, and through our third-party test laboratories, we have shown not only on live SARS-CoV-2 to get nearly a 3-log reduction in just 1 second of exposure. We've also shown that for MRSA, A. baumannii, E. faecalis, Klebsiella, Salmonella, E. coli. We've shown between 3 and 5 log reduction in just 1 second of exposure. Mm-hmm. So really, this is a device that can be used even outside of the hospital. We've had a lot of interest because of this pandemic in other marketplaces like education, hospitality, and even building service contractors, trying to help people get their businesses and their schools up and running again.
Nick, where can our listeners go online and get some more information about NuvaWave and about UV Innovators as well?
Yeah, it's really simple. NuvaWave.com, NuvaWave.com. NuvaWave, NuvaWave.com. We are the new wave of surface disinfection.
Dr. Medendorp, I appreciate you joining us here, giving us this information. Thank you so much.
Thank you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Nick Medendorp, CEO of UV Innovators. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.